Hey, Dr. Wages, good morning. What are you doing here today?
Well, good morning, everybody. This is our Botox day where we treat our patients who are interested in Botox and fillers. So the day is set aside just for that one type of patient. These are patients who've already had Botox, so they kind of know what they're getting. And they like to come in and have an efficient treatment. So we've already determined what their treatment plan is going to be, and we're just doing their maintenance treatment. So as a Botox day, we make our product fresh. We use genuine Allergan Botox. There's only one manufacturer of Botox, which is Allergan. And when you get these vials from the manufacturer, and the manufacturer is the only authorized seller, so some people buy it from Canada and Mexico at a discounted price, and it can't be genuine Botox if it comes from those locations. It's got a special label on here that has a special reflectiveness to it, and so that demonstrates that it is genuine. So we open this up, and before we get started, we have a clean surface. We wash our hands, and then I put on some little gloves.
So you have to have a fully sterile situation to make sure you don't get any contamination in the product.
You definitely want a very clean situation here, and I actually go to the method of actually having a mask in case I were to inadvertently cough or sneeze. I just don't want to potentially contaminate anything. So we're all cleaned up and ready. So we have our Botox. We open that up. There's manufacturer insert information. I've read it before, so I don't need to read it again. This is sealed. We open that up, and it's reconstituted per the manufacturer's instructions with saline, preservative-free. Some people use saline with preservative, thinking it can last longer. This Botox is designed to be used immediately, and it'll be used today. And so we go with the manufacturer's recommendations, which is preservative-free. And then they have a concentration they recommend. Some people dilute it more. We go with what's exactly recommended by the manufacturer.
How many years have you been doing Botox injections, Dr. Wages?
So we've been doing Botox since Botox came on the market. And you know, it is amazing how it's exploded every year. It goes up. On our Botox days, we average about 10 vials of Botox that we'll go through. And so over the period of a year, we go through about 150 to 180 vials of Botox. And so we are a diamond Botox distributor. And so we're going to draw this up.
And that's a preservative-free saline solution?
Yes, ma'am. So it says exactly how much to use, and then this is just inserted directly in. This is actually a vacuum container, and so we let it just drizzle right in. Goes into the shark bucket. You're not supposed to vigorously shake this up. You actually just let it swirl, and then it reconstitutes almost immediately. So I'm going to let that sit there for a minute. And we have a patient list, so I know how much each patient, because these are established patients. And so, for example, this patient's going to need 20 units. So we have a small syringe here.
Are those smaller syringes than most people use to inject it?
So these syringes are a small syringe, so there's only a limited amount of material that can go into a syringe. And so for different reasons, I'll use different amounts. I like this. This is a 1 cc syringe, and it comes with a 27 gauge needle, which is like a diabetic insulin needle. It's very small.
Why do you choose to use those needles?
So this needle comes already on the syringe and allows me to draw up the product. After I've drawn up the product, I'm going to change needles to a tinier needle. And so we draw this up, and it's slow and easy. And once this is all drawn up, you can see it takes a couple minutes to draw this up. So that's why I do this early in the morning and have my patient's syringes already ready. So when the patient comes in, it's just a matter of doing the administration and not fiddling with this material. Okay, so then I'm going to take that needle off. It's disposed of. That needle going through the rubber stopper dulls it just a little bit. And so a dull needle hitting your skin can be painful and irritating. So now we're going to go with a smaller needle. So this is a fresh needle. It's never been used. And now it's covering our syringe. So this patient's syringe is ready to go. I then mark the end of the syringe with the amount that we're going to use. So I know how many units. I know how many units by measuring that, but this is also just a way to double check that. And now this is in a tray, and this is going to go in the refrigerator with the patient's name on it. And then I'll draw up the next for the next patient. So at the end of the day, I will have all these syringes pre-filled and ready to go, so that when the patient comes in, their treatment is very quick and efficient.
Well, that was really interesting. Thank you so much, Dr. Wages. Have a great day, everybody.
Okay, we'll see you guys soon. Thank you.